Module 5, Patient Navigators Roles and Responsibilities. After completing this module, participants will be able to know concepts and principles of patient navigation, describe characteristics and qualities of patient navigators, understand patient navigators' roles and responsibilities, and know about effective client relationships. Patient navigation is a patient-centered health service delivery model. The key function of patient navigation is to eliminate barriers to access care. In patient navigation, a person, called as navigator, engages with patients to identify and address barriers to access healthcare. The concept of patient navigation was first developed by Professor Harold Freeman in 1990 in Harlem, New York. The patient navigators can be lay community members as well as professionals such as medical assistants, social worker or nurse. Community health workers are considered most suitable for this role if they belong to the same community to the patients. Patient navigators do not provide direct health services to patients, but act as a link between the patient and health services to improve patients' access to health services. Patient navigation is important because of the complexity of the health problems with many patients having multiple conditions and complexity of the treatment or management they required. Patient navigation is also important because of the disconnection between different parts of the health system, and many patients often need to be actively engaged with their own care. There are several principles of patient navigation, such as patients are at the center of patient navigation. Patient navigation helps to integrate a fragmented healthcare system for the individual patient. The core function of patient navigation is the elimination of barriers to timely care across all segments of the healthcare continuum. Patient navigation should be defined with a clear scope of practice that distinguishes the role and responsibilities of the navigator from that of all other healthcare providers. Who should navigate should be determined by the level of skills required at a given phase of navigation, and the point at which navigation begins and the point at which navigation ends needs to be clear. What are the characteristics of patient navigators? Now, patient navigators are related with healthcare team, patients, and community resources providers. They will be a creative problem solver and a knowledgeable resources. But while being a knowledgeable resource, they should be sensitive to information overload to the patient. The navigator will be an organized information manager as well. There are some tools that can help the navigators to keep on track. For example, a bound calendar with space to keep notes, a tickle system to remind the navigator of important dates, files for each patient, clashes of time management, a system for keeping patient information private. Patient navigation involves working with members of the healthcare team to facilitate patient healthcare, promoting patient health and comfort, supporting patients while they learn to self-navigate, and let the healthcare team know about the availability of patient navigator services. Let's look at some of the potential roles of patient navigators in Australian general practice. The navigators can provide in-language information at practice premise. They can liaise with the receptionist with tasks such as completing paperwork, helping to reinforce doctor's advice or instructions, and so forth. They can inform patients about the local resources and education groups. They can help patients to navigate to local services and resources by arranging transport, liaising with services, accompany to the services if necessary as well. They can help make and remind appointment with the health services, help arrange transport and accompany patients to the health services if necessary. They can help effectively link the patients with the service providers at every stage of the health service delivery, and they can contact patients to check that they can attend the referral services. But it is notable to mention that these are possible roles and that they need to be negotiated with the specific practices. For developing effective patient relationships, the navigator needs to be caring. That means they should understand patient need. They should be willing to help and have empathy. They have a good communication skill. That means they should listen, communicate, and trust. The navigator should also have a suitable level of competence. That means they should listen with empathy, explain things clearly, and speak openly about their concerns. So here is a case study of Maria, who is 55 years of age, who is migrated to Australia from Lebanon 20 years back. She has been diagnosed with high blood pressure and heart disease few years back, and her GP asked to have regular follow-up for this. She drinks an average of 5 cups of coffee during the day and smokes 1 packet of cigarette per day. She has also been steadily increasing her use of wine over the years. The last time she saw the doctor was 5 years back, and her GP suggested to reduce her weight by 30 pounds, lower her stress level, quit smoking, stop adding salt to her meals, and exercise more. Doctor also asked her to get mammogram, colonoscopy, and pap smear, which she never done. However, Maria kept gaining weight and became very discouraged and depressed. She doesn't like to exercise because she finds it embarrassing. She also has poor adherence to medications. Maria has very low health and digital literacy as well. Now think of the following questions. What could be the role of a bilingual community navigator in this case? How the bilingual community navigators can motivate Maria in adapting healthy lifestyle? And what are the other navigation roles that bilingual community navigators can play? So this is the end of module 5. Thank you very much for listening.